continues here on One News Now. I'm Riza Diaz. Quezon City arrested more than 300 violators on the second day of Metro Manila's unified curfew. Local authorities are also strictly implementing a new directive that prohibits minors below 18 years of age from leaving their homes. Let's get more details. We have JC Cosico reporting live from Quezon City. JC?
Riza, amid the spike in COVID-19 cases, only those aged 18 to 65 in Metro Manila will be allowed to leave their homes for now. This means minors below 18 are again bound to go out of their houses over the next 2 weeks. Penalties for minors found outside their homes will depend on ordinances passed by their respective LGUs. In Barangay Santo Domingo in Quezon City, personnel roamed around the area to remind residents about the new restriction. Their CCTV cameras and PA system also help them monitor the compliance of residents to health standards. Some residents even canceled their trips to the provinces for the Holy Week. For his sport, IATF coach Nograles said that it's best for tourists planning to go to the provinces to coordinate with their trips with LGUs and find out if minors are welcome in their area. The MMDA also clarified that minors 15 and above may travel for the Holy Week as long as they're with their families in a personal vehicle. Riza, some minors also caught and were brought here at the barangay hall after they were caught outside their houses, and their parents are the ones who will face the penalty. Back to you.
Thank you for that report. That was JC Cosico reporting live from Quezon City. American philanthropist Melinda Gates underscores problems in global vaccine distribution and the reasons why women and minorities are hit so hard by this health crisis. Gates discusses these issues with Emily Chang as part of Bloomberg's Equality Summit this week. Let's take a listen.
Well, I think it's working in some of our high-income countries. We're starting to finally see, much broader distribution, for instance, in the United States and in some of the European countries, but it is not at all working yet for middle and low-income countries. And, those are places where people are struggling. They have their loved ones who get ill. They can't get them to a hospital, much less an ICU. And so they are really still struggling in many countries around the world.
So there's obviously a moral case for vaccine equity, but what about the economic case? Why should somebody in New York or San Francisco care when somebody in Africa gets the vaccine?
Well, absolutely, it's the right moral thing to do. But economically, we're not going to have as swift a recovery in the United States or in Europe if we don't make sure that everybody gets vaccinated, because what will happen is this disease, we know it crosses borders. We've seen it all over the world. And so as these variants break out, they will absolutely come back into the United States and Europe and Japan. And so our supply chains won't fully be up and running. We won't get our travel industry fully and leisure up and running, or the business community up and running in terms of travel. So economically, if we're going to reopen the global economy, we've got to take care of this everywhere.
So if vaccines aren't distributed equally, obviously there's economic consequences. There will also be more deaths. What are the consequences of that?
Well, more deaths, it's a tragedy for every family that experiences a loss. But it's also, I think we have to remember, it's wreaking havoc on the healthcare systems of these countries. And so what it means is a mom who is pregnant doesn't go in for her antenatal visits. She doesn't go in for delivery. So she has an unsafe delivery at home. It means we have 49 million women that won't get contraceptives during this pandemic. That means 15 million unplanned pregnancies in 1 year. That's like adding up the cities of Chicago, New York, and LA and saying we're going to have 15 million unplanned pregnancies. Wow.
Vaccine czar Carlito Galvez Jr. says senior citizens are set to be inoculated against the coronavirus disease starting next month. Let's get more details we have regarding this development regarding the government's vaccine rollout. Greg Gregorio will tell us more. He's reporting live from Mandaluyong. Greg, did Secretary Galvez give a hint as to which vaccine brand will be administered to senior citizens?
Riza, according to Vaccine SAR Secretary Carlito Galvez Jr., they are more likely to administer Sinovac doses to senior citizens, as according to Galvez, there are lesser adverse events from those individuals given with the Sinovac doses as compared to those given with AstraZeneca shots. However, he did not give any numbers to compare the number of adverse events recorded depending on the brand given to each individuals. Riza?
Greg, how many health workers so far have been vaccinated?
Riza, according to Galvez, yesterday, 20,233 health workers have been given their first dose. This pushes the tally of the number of individuals given with first dose to more than 240,000. Riza?
Now, given this number, how many adverse events have been recorded following the vaccinations, and are these majority mild reactions only?
Yes, Riza, Galvez said there are about 5,000 adverse events recorded since the government started vaccine rollout on March 1. But Galvez highlighted that most of these are mild and common adverse events recorded during vaccination, and it includes fever. Riza?
So will vaccinations for medical frontliners continue next month while seniors start to receive their shots?
Riza, what Galvez said is that they will finish administering first dose to 1.7 million health workers, and then they will follow the inoculation to about 4 million to 9 million senior citizens. But the inoculation to these individuals for the second dose may be simultaneous, as the interval for the second dose between shots of Sinovac and AstraZeneca is different. For Sinovac, we are expecting to have a 4-week interval, while for the AstraZeneca shots, we need 3 months interval between two doses. Riza?
Greg, update us with the figure. How many vaccine doses is the government expecting to receive this month?
Riza, according to Galvez, we are expecting 1 million doses of Sinovac vaccines on March 28 as part of the government's procurement. But apart from this, Galvez earlier mentioned that we are also expecting 400,000 doses of Sinovac as part of the donations from China. Apart from this, we are expecting more than 900,000 doses of AstraZeneca shots from COVAX facility from either late March or early April. In total, we are expecting about 2.3 million doses of COVID-19 vaccines. Riza?
Finally, Greg, so the list has been frontline healthcare workers, then elderly, which is of course priority sector, is next in line for inoculations.
Riza, after inoculating healthcare workers and senior citizens, according to the priority list of the government in this vaccine rollout, we're expected to inoculate those people with comorbidities and then those other frontline workers, and then the indigent population before we inoculate the general population. And according to Galvez, this may start by May to June this year. Riza?
Thank you for all those information. That was Greg Gregorio reporting live from Mandaluyong. The health department says 13 cities in Metro Manila are now affected with COVID variants of concern. To check in on our latest COVID-19 situation, Jen Kalimon is joining us live from Malabon. Jen, how many areas outside NCR are also affected with other COVID variants?
Riza, Dr. Alethea de Guzman of the DOH Epidemiology Bureau only mentioned the variants of concern which pose more danger to the public. So far, we have 5 regions with local cases positive for UK variant. Aside from NCR, we have cases of UK variant in Central Luzon, Calabar Zone, and Negros, while the South African variants were found in 3 regions such as Cagayan Valley, Negros Island, and also in NCR. Riza.
Among these, which COVID variants, Jen, is prevalent in the country and in Metro Manila?
Well, Riza, the most prevalent COVID variant of concern is the UK variant. So far, we have 87 cases of these. The highest is in Car with 41 cases, NCR with 39 cases, Calabarzon with 4 cases, Central Luzon with 2, and 1 case in Negros Island. As for the South African variant, NCR has 64 cases, Cagayan Valley has 2, Negros Island region has 1 case. Riza.
Do we have information, Jen, already on how did these variants spread across the nation?
Yes, Riza, according to DOH, they attributed the surge of cases with the emergence of various variants of concern, which I mentioned a while ago. But they also said that even before discovering these variants, there is already an upward trend. Even cities without variants of concern have experienced growth in cases. Mobility and non-adherence to minimum public health standards are also driving the surge. In terms of mobility, there is an increase during holiday season because people were going to the grocery, pharmacy, parks, workplaces, transit station, and recreation, among other places. Riza?
So if variants continue to become dominant, Jen, how many cases are we expecting to see according to the health department?
Well, Riza, if these variants of concern became dominant virus, cases will increase by 28 times instead of just 3 times after a month. The baseline of reproduction rate is at 1.25, but for variants of concern, it could jump to 1.95. The DOH also said we have reached a peak which DOH saw in July last year. NCR has also reached last year's peak, while selected NCR cities have the same or more cases now. They're also reporting 2.5 times higher cases this March compared to the cases during the start of January. So with this given data, Riza, the DOH is continuously reiterating the need to take the minimum public health standards seriously to prevent this increase of cases. Riza.
Jen, with that, now that the government is implementing stricter protocols, they're holding on the borders, how long before we can expect to see a slowdown in transmission?
Well, according to the DOH, we have to wait for 2 to 3 weeks to find out if imposing curfew among minors and the temporary suspension of travel into the Philippines for foreigners and non-OFWs would have a significant effect to the number of cases. Riza.
Did they mention anything about wearing face masks and face shields? Are those still effective considering the presence of these new variants of concern?
Yes, as with the compliance of wearing face shield and face mask, they found out that the combined individual effectiveness of using these two is at 99.9%. The DOH is also suggesting to wear face masks at home, especially if they are in their common areas with their other family members. Riza.
Jen, what areas are considered high risk? And how about those that are already slowing down?
Well, right now, the DOH Epidemiology Bureau is observing a 57% positive 2-week growth rate nationally. This was just 14% 3 to 4 weeks ago. They also reported that 10 regions has positive growth rate, while there's a slower negative growth for the other 7 regions. So NCR and CAR are at high risk. Bohol is showing a steep rise of cases, while there's a gradual slowdown observed in Cebu provinces and in Tri-City.
Final question,
Riza.
Jen. Is the P3 variant originally found in the Philippines already considered a variant of concern?
Well, the answer is no. For now, it is called variant under investigation. For the Epidemiology Bureau is still conducting studies with regard to the impact, transmissibility, and immune escape of this particular P3 variant. Riza.
Well, thank you very much. Jen Kalimon reporting live from Malabon. Israeli archaeologists have discovered a trove of artifacts, including never-before-seen fragments of a biblical text. The hidden trove was found in caves near the Dead Sea. Among the artifacts collected were ancient coins, a 6,000-year-old partially mummified skeleton of a child, and an intact weaved basket dating back over 10,000 years ago. But what got the experts really excited was this new piece of ancient Jewish text called the Dead Sea Scrolls.
For the first time in over 60 years, we have fragments of a biblical book that were discovered in an archaeological excavation. So these are new pieces of the puzzle, and we can add them to our greater picture of the period and of the text. And even though these pieces are small, they did give us some new information that we did not know before.
And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.